I think the position at the moment with listening and taking a breather is making it quite difficult to maintain with GPs that commitment that this is really going to happen and that their involvement in commissioning is really going to make a difference.
Do PCTs in a way relish the fact that things are going a bit wrong, Martin?
I don't think we do at all. In fact, I think they're a distraction from the job in hand, which is we need to focus on delivery. I don't think anything's changed. We know what the challenge is. We know we've got to do something about it, but all the noise at a high level is distracting everyone from what we actually should be doing.
You're a strategic planner, but how do you strategically plan when the goalposts are moving?
Well, because a strategic plan is not about tactics. A strategic plan is over many years, and actually over the last 4 years, despite it perhaps changing its name in various, coming out in various guises, what we have aimed to do, where we want to be, has remained constant about improving health and improving health services. So I don't think that's difficult. I think it's the way that clinicians and managers are being distracted from what really needs to be done.
There have been lots of ideas discussed today about the way that things should move forward. Do you think that it will be very individual to individual commissioning areas, Lisa, or do you think there is more of a level playing field going on now?
I think across the country you'll see key areas that we'll all work on. So long-term conditions, which means people with diabetes, people with chronic lung problems. Actually, we know we can deliver that care in a different way, closer to people's homes in the community. It's better quality and it costs less. But you will see variation. So residents in Slough are different to people who live in Devon, who live in Lincolnshire. So actually there should be some variation. You should see a difference in service because that reflects that patients are different.
Can I add to that? And I think this is actually one of the things which maybe people haven't quite yet grasped. We're going to have a National Commissioning Board which will set out the standards, the framework, the guidelines through NICE. What GP consortia will be doing is commissioning implementation, if you like. So we talked earlier on about where's the strategy. Well, I think the strategy is a plan for the NHS. And I think that then what we need the GP commissioning consortia to have the flexibility to do is do commissioning implementation at a local level of a national health service.
Lisa, what are your secondary care health providers saying? There's been a lot of talk today about integration and about whether the secondary care should be involved in commissioning or not. What's the general feeling where you work?
Where I work, the consultants, the hospital nurses understand that actually we have to work together, we have to get closer with primary and secondary care to make real change. Simply looking at each other and saying it's your fault isn't good enough. But underneath that there's a tension, and I think it would be wrong to forget that tension, because actually if you move more services into the community you can see real changes happening in the hospital, and I think there's real nervousness about how those changes in the hospital will be managed.
Are you finding ways of making that work in Lincolnshire?
Yes, we've been doing this for the last 4 years. So we have something called Prescribing and Clinical Effectiveness Forum, which is a joint clinical managerially supported forum for GPs and specialists from across Lincolnshire to make decisions about how we should invest our money in areas in commissioning. I also think people overlook the fact that a lot of commissioning is already driven by specialists. I sat in a meeting on vascular services last week, and the Vascular Surgical Society has defined, almost specified, how vascular services should be commissioned. And what we're doing locally is doing commissioning implementation of a nationally defined service, which really is being driven by specialists.
Do you have concerns as NHS managers about dealing with any willing provider, and specifically the private healthcare sector in the future?
No more concerns than I do about getting any specification for a service right. Actually, you've got to be clear, what are we trying to do? What's the improvement that we're trying to get? How do we make sure that that improvement is being delivered and getting the best value for our money?
How do we move forward now at the end of the listening exercise?
I think what we're looking for is clarity around the governance arrangements. I don't think anything has changed about what we need to deliver. We need to put clinicians in the driving seat on transforming services and being accountable and owning the agenda, driving it forward and making sure that we maintain value for money, where value for money is quality times cost, so I'm improving patient safety, effectiveness and the patient experience in the system. It ain't rocket science, it's actually doing it, which is the hard bit, and convincing the professions that they are in charge, they are accountable, they are responsible, and they have an ethical duty to do it.
Anything to add to that?
No, I think it is about that clarity of purpose with clarity of success. And actually we need to work with the clinicians and keep encouraging and involving them as we go forward.
Thank you very much for your time.
Thank you.
Thank you.